This is from a company called Marmed, and it's basically just this little silicone ladder that can be cut down to whatever size that you need. All right, so I'm not going to cut this because I need to be able to reuse this for other demonstrations. But let's say you've got this incision right here, and you want to put something in there just to facilitate a little bit of drainage. So what I can do is grasp the ends of this with my hemostat and essentially just put this into the abscess cavity, and then I can cut this right here, put a bandage over it, and then the patient can remove this in 3 to 5 to 7 days. All right, so that's a great little tool for you to at least be aware of. The other thing is that you can take this same device and kind of treat this as a vessel loop. So I can introduce this here, bring it out to the other side, and then voila, I've got a vessel loop type of procedure already done. And then I just cut this off. And then again, the patient can cut this at home and simply remove it in a couple of days.